If one of your parent is suffered or had heart attack, you are likely to develop it 30% chances. If both your parents have had significant heart-related issues, you are likely to develop 50% of the chances.
If you are following a regular routine with regular exercise and a proper diet, even after that you'll have the chances, because fitness decreases the risk of you having a heart attack, but it doesn't make you immune from it.
Can I have a drink or can I not have a drink?
Moderation is the key. And the habits associated with alcoholism. Alcoholics, as you see, they smoke a lot. Second thing is what they eat. Lot of fries, a lot of masala, lot of salt.
Some athletes use drugs to increase their activities, to gym goers to make muscles, so that leads to cardiac diseases.
Now we're hearing more about people in their 20s, 30s having heart attacks. What has changed? Hi, I'm Jagu and welcome to the Good Doctors Podcast by Zynova Shalby Hospital, where we bring you expert insights on health and wellness. Heart attacks are sudden, but are they truly without warning? Today we uncover the reality of heart attacks, how to spot the signs before it's too late, what to do in an emergency, and the myths that might be putting you at risk. Guiding us through this critical conversation are Dr. Krishnarao Bhosale, a renowned general surgeon, and Dr. Abhilash Mishra, a leading cardiologist at Zynova Shalby Hospital. Stay with us as we separate fact from fiction and help you safeguard your heart health. Dr. Bhosale, Dr. Mishra, welcome to the podcast and thank you so much for taking out the time doing this for us and educating us in a way. Much appreciated. So, Dr. Abhilash, let me come to you. We hear the term heart attacks. I want to get into the practicalities of it. We hear the term heart attacks, but we to just say it. What is actually happening inside the body? What is a heart attack, as it were?
Okay, so to start with, basically in heart attack, what happens is heart itself is supplied by the blood through the vessels of the heart.
Sure.
So while having a heart attack, one of the vessels get blocked. So on blockage, the blood, the oxygen which is required by the part of the heart is not there.
The oxygen which is coming through the blood.
Yeah.
Okay.
So it doesn't reach the heart. So while if it doesn't reach the heart muscle starts dying. And once it starts dying, so it leads to all the symptoms and everything. And that's what is happening inside the heart.
So when we say heart attack, there was always an association of, when you're senior is when it happens. But now we're hearing more about people in their 20s, 30s having heart attacks. What has changed? Is it a lifestyle thing or are we just more aware? How is it working, doctor?
I think Dr. Abhilash, he briefed as to what is heart attack. The cause of heart attack is easy to understand if we know it's a demand-supply mismatch disease.
Okay.
See, heart requires for its function, that is contraction, relaxation, pumping, good amount of oxygen, good amount of energy, nutritional substitutes. And this all comes with blood. See, any obstruction to the flow of blood will cause changes due to less blood supply, less oxygen, less nutrition coming to the heart muscle.
Fair.
Heart muscle being a constantly acting muscle demands higher oxygen, higher nutrients. So any change in the supply vessel size, the lumen, which ultimately is responsible for giving adequate flow of blood to the heart muscle. So any block coming in the blood vessel which supplies the heart will influence adversely the supply to the heart muscle, and then we will have symptoms of what initially we call ischemic symptoms. Ischemic means there is reduced blood supply, which is responsible for those symptoms. But when the blood supply is totally blocked, the heart muscle supplied by that blood vessel will undergo changes of devitalization.
So,
That becomes a dead muscle, dead
which is what Dr.
tissue.
Abhilash made a
Yes,
reference to. The
yes.
muscle is dying. So
So
there is a difference now between partial flow and a
yes,
complete
there
stop.
is, there is,
Okay.
there is. That is why I brought the issue.
Sure.
Heart attack is total stoppage of blood supply, whereas ischemic relations are still the vessel is open, but it has significant obstruction to the blood flow.
And so, simply put, this is where the play between should we do a surgery or should we put a stent comes into play.
No,
No.
I
That's
think
not where it is.
That's totally true.
Okay, okay. Sorry, explain that, doctor.
Yeah, no, we were talking, your question was on the younger age group, right?
Which is, so partially,
Yes.
we've already
So
got into that
when-
subject from the point of view that are there partial blockages with younger people and then they get
see,
worse
the
as they get older?
blockages don't come overnight.
Sure.
The blockages take years to develop. And when we talk of these blockages, we consider multiple risk factors as to which individual will develop it early, which individual will likely to develop it late.
Sure.
So these risk factors, very common risk factors, heredity, that is our genes, which influence significantly. As the statistics goes, if one of your parent is suffered or had a heart attack, you are likely to develop it 30% chances. If both your parents have had significant heart-related issues, you are likely to develop 50% of the chances.
Fair.
So this is how the heredity plays an important role. The risk factors, which are what we call modifiable risk factors, is what we should look at, which are more often responsible for early heart events.
Okay.
See, when you have a young individual with high cholesterol levels, sedentary lifestyle, obesity, smoking, irregular dietary habits, or diet with very high oil salt content, diabetes, hypertension, renal disease, thyroid disease. You have so many components in the risk factors.
Sure.
So the
And these are the
combinations
modifiable ones.
Yes,
Okay.
these are the modifiable risk factors. So what we see, younger patients with higher number of risk factors are likely to develop it early.
Okay.
And I think this is where we are, because of the risk factors not being properly managed, patients come to us early
Fair.
with heart diseases.
Okay. So I take your point completely about risk factors, especially the modifiable risk factors. Hereditary, one has no control over.
Yeah.
Diet, sedentary lifestyle, all of that, sleep patterns, all of that one can take care of. Now, Dr. Mishra, let me come to you with this. The flip side of it is somebody who is actually taking care of himself or herself. Okay. So regular exercisers, good diet, good sleep pattern. But sometimes we see even gym goers, marathoners suddenly developing a heart issue. Like, unfortunately, sometimes even to the point of them passing away. What is happening there? What are these hidden risk elements that we are completely ignoring?
So basically, as the sir said, there are multiple modifiable risk factors, and if you are following a regular routine with regular exercise and a proper diet, even after that you'll have the chances, because fitness is decreases the risk of you having a heart attack, but it doesn't make you immune from it.
Sure.
Because there are multiple other factors which cannot be changed, as which we know ki it's non-modifiable factors. So there is genetic factors.
Sure.
So the one which we have seen, people playing football and they generally collapse. So they probably might be suffering from which we call as an entity of hypertrophic cardiomyopathy. So in that there's generally these symptoms are there.
Explain that to me, this hypertrophic cardiomyopathy.
Hypertrophic cardiomyopathy is a genetic disease in which your heart muscle is in size more than normal at a particular place.
Okay.
So because of that, there is an obstruction in the outflow of the blood.
I see.
So the blood comes out, there is an obstruction over there and it suddenly collapses. So that's a sudden collapse. So that is generally in screening which we get.
This is not, is this going down the road of erratic heartbeat?
No, not
arrhythmia or something like that?
That
No.
can lead to arrhythmia, but
I
it
see.
doesn't. It's basically main to the outflow tract obstructions.
Okay. So,
That's a genetic thing.
okay, that's genetic.
And plus over to that, there's which we call the fit person will say ki no disease can happen to them. So they generally neglect the symptoms. They will say I am having muscle fatigue. So these all symptoms are not related to heart.
Fair enough.
That's a basically denial part of it.
Okay. Mana, if they feel exhaustion, then
I'm
I'm tired, but there's nothing wrong with my heart.
So
I see.
they neglect and they come to the hospital at a late place, late timing.
Yeah.
And the other thing is some athletes use drugs to increase their activities, to gym goers to make muscles. So that leads to cardiac diseases.
Okay.
So that increases the chances of you having a heart attack.
Fair enough. So there's that element of it. But in terms of differences, and Dr. Bhosale, let me come to you with this. While we're discussing differences, healthy, not healthy, all of that, men and women, different symptoms, different issues, or are they under the same broad category when it comes to heart?
Women up to the stage of menopausal physiology, they tend to behave little differently. We consider them a little immune with heart diseases, especially when they are under the cover of hormonal protection. See, once the hormonal protection decreases, they tend to develop heart problems almost similar to the male counterpart.
Okay. Symptoms
Symptoms
could be similar or even different?
Symptoms-wise, see, the common symptom of heart attack is chest pain, breathlessness, shoulder pain, neck pain. All these, as we see in our population, females are more tolerant. They tend to ignore their symptoms more frequently than the male counterparts.
Fair enough.
So this is where the psychosomatic aspect comes. The mind influences body, and there the symptomatology is differently interpreted and expressed.
Okay. So, it's interesting that you're bringing up symptoms, because the one thought in my head also, and Dr. Mishra helped me out with this, then there are silent heart attacks. Does that mean zero symptoms, or does that mean I have ignored the symptoms? Can I have a heart attack without any symptoms?
You can have a heart attack. Basically, in the present scenario, everyone knows that a heart attack will have chest pain.
Sure.
Chest pain is equivalent to a heart attack.
Because Bollywood has shown me the way.
Yeah.
Yes.
So, in silent heart attack, by silent heart attack, we mean you are not having chest pain.
Okay.
So, basically, there's a group of people which can present to you with other symptoms. And when we do our ECG and everything, we get to know that he's having a heart attack. He or she is having a heart attack. So, this particular group, generally, we have older people, older age people, and the diabetic people and women. These three group of people generally many a times won't be visiting you with a complaint of chest pain. So in that scenario, there are other symptoms which we neglect generally. We say it being acidity, or we say just as abdominal pain. There might be you'll be having just a jaw pain. Jaw pain will be neglected. Ki this is the regular pain. Females generally
You don't
neglected.
even relate jaw
Yeah.
pain. You're thinking tooth problem. You're not thinking heart at this point.
Even if you are having nausea, gastrointestinal symptoms. So nausea can also be a symptom of a heart attack in such group of patients.
Fair. Okay.
Having just sweating.
Okay.
Sweating is also a symptom of having a heart attack.
So there are the obvious symptoms. You feel a shooting in the left arm, you feel a pain in the chest, all of that. There are these other symptoms that also come up. We're calling them silent heart attacks because we didn't really recognize them. We didn't associate an acidity issue or a jaw pain issue with a heart problem.
Yeah.
But the idea, and going back to what Dr. Bhosale was saying, is that you have to be a little bit aware, a mind over body kind of situation.
Yeah.
Is that a fair assumption to make?
Yeah.
Okay. Now, Dr. Bhosale, diabetics, are they more prone? What is the connection if they're more prone?
See, diabetes is what we label metabolic disease. It is not just sugar which rises and we control. See, diabetic can have multiple organ issues. The most common consequence of diabetes is what we in our language call microangiopathy. That means the smaller blood vessels of almost every part of the body in diabetics undergo changes due to inflammation and obstruction. And when that happens, the diabetic angiopathy, the diabetes related changes in the blood vessels, when they take place, it is a enhanced obstructive pathology which comes in diabetic patients. And obviously, when an enhanced obstructive pathology of blood vessel comes, that is going to influence the supply of blood to given organ very significantly. And that is how a diabetic is more prone not only to heart attacks, he is more prone to strokes. He is more prone to gangrenes of the extremities.
Yes. Yes.
So these are all related to the influence of diabetes.
So this is a bigger
multiple
picture
organs.
issue. This is diabetes affects multiple organs, mostly having to do because an organ needs blood, oxygen flow,
Yes.
etc., etc. Heart just happens to be one of them.
Yes.
But it is a bigger worry across the system. I mean, we're aware of that.
Absolutely.
But sometimes we don't really focus. We just focus on the sugar element and we try to control that.
Yes. I think modern day practice of diabetologists, the diabetes experts, is they don't just look at the diabetes. They 100% look at the other target organs.
Yes.
Eyes, kidneys, heart, peripheries. So all these areas are assessed while treating diabetes.
Fair enough. And the heart comes within that
Yes,
that's fair.
heart is there in it.
Okay. So let me get to preemptiveness or protective care, as it were, Dr. Mishra. More and more information comes out, and one of the reasons we're doing this podcast is so that we get a very clear medical and professional point of view. Because if you read about it you see it on social media, you read about it in an article that is not necessarily medically proficient, then one starts making assumptions basis wrong data. But let me cover that step by step. There are studies that have shown that a lack of sleep can affect you. Now, people, especially in metro cities, lead busy lives. We're handling home, work, socializing, our own thing, as it were, our own me time, as it were. In all of that, sleep takes a beating. Is there a minimum? Is there a maximum that one should be doing? Is there a perfect correlation between lack of sleep and heart disease in particular? How does that work? Where is the research on that?
So basically, sleep, you need to have a complete proper sleep of at least 7 to 9 hours.
Okay.
And that too in a continuation. It's not like that ki because of a stressful lifestyle we are sleeping 1 hour in afternoon, then we are dividing our sleep.
So this is important. This 6
Yeah.
plus 2 is not working. I can
No.
take a long afternoon nap, but I have to sleep late or I have to get up early. Oh,
No.
it has to be straight.
Yes.
Okay. Why does it have to be straight? There is some repairing going on in the body,
Yes.
isn't
So,
it? Can you explain that?
So basically, by sleeping, you are decreasing your inflammation levels. Your blood pressures are under control. By repeatedly breaking your sleep, your blood pressure shoots up once you get up. So the blood pressure control is also decreased by interrupting your sleep. Just like nowadays, our phones are there. We get a call in the night and everything. So we are not getting a proper amount of sleep.
Fair.
So this is the thing. Because of that, at least if you are having sleep less than 6 hours a day, so it has shown, study has shown that to increase almost 40 to 45% of the heart diseases.
That much risk?
Yeah,
It increases it by
40%.
almost half. Wow.
Almost half.
Okay. So there are two elements here. The amount of sleep that you get and also the...
Quality of sleep.
Okay, so make that 3 elements then.
Yeah, yeah.
Okay. Amount of sleep, quality of sleep, and also schedule of sleep.
Yeah.
Can you just break that down for us briefly? So I have to sleep at one standardized time. Do I
Yeah.
not? If it's 11 o'clock, then it should be 11 o'clock. It can't be 10 o'clock one day, 1 o'clock in the morning the next day. Is that a fair assumption to make? Okay. And how do you mean by quality?
Quality means that sleep should be a sound sleep. That means it shouldn't be disturbing. You shouldn't be waking up multiple times while having sleep.
But uska control नहीं रहता ना sir.
If you are getting up by your own self, that's fine.
Okay.
Getting disturbed by someone, getting this,
Ah.
that's because you are getting, it's like nowadays you are getting phone calls. So
Yes.
phone calls means you are having stress.
Yes.
So it increases the stress in that way. And with that, your blood pressure shoots up. So it doesn't maintain a proper level
Okay.
for the complete night.
So getting up and going to the loo is one separate matter.
that's
But attending phone calls after you have turned off the lights is a whole separate problem.
Yes, yes.
Okay. What can one do to help quality of sleep? Sure, airplane mode, shutting off the phone, all of that is there. But in terms of temperature, in terms of brightness of room, are there any precautions one should take?
No, that's up to you.
Okay.
Yeah.
But just the idea is the end result should be get a clear 7 to 9 hours of sleep, as regularly as you can.
Yeah.
Okay. The other important takeaway is that get it in one line.
Yeah.
Don't break it up into
Yeah.
2 parts in the day. Okay. Fair enough. Dr. Bhosale, let me come to you with another element. Cholesterol. We know cholesterol is bad. One says that. But there are elements to that, isn't it? Good cholesterol, bad cholesterol. What are the impact of that on the heart and how does one control for these things?
Cholesterol, good and bad. The concept is related to what metabolic activity is going on in your body.
Now, this is different for each person.
Yeah, it's likely to be so.
Okay.
Everybody will not have cholesterol management same way.
Okay.
So when we talk of cholesterol, see, is a one culprit which is responsible for creating blocks in the blood vessels. See, when we say blood vessel is developing a block, it starts with small deposit of cholesterol and related lipoproteins, as we say, in the inner layer of the blood vessel. And once that spot becomes a plaque, a thickening of the blood vessel, it starts creating obstruction to the blood flow. So deposition of cholesterol is obviously related to the cholesterol level of the what we call LDL, the low density cholesterol lipoproteins.
What we call bad cholesterol.
Bad cholesterol. Okay. The other cholesterol you are asking about is high density cholesterol, and that is related to your muscular activity. So your muscular activity will generate high density cholesterol, which is good.
Okay. So by muscular activity, you mean literally walking from one place to the other, or are you specifically saying strenuous exercise?
Not necessarily strenuous. The muscular activity. See, it need not be strenuous. It need not be exertional.
Okay.
You can walk for 2 kilometers, 3 kilometers, and that is good enough.
Okay.
So once the HDL level is also to be maintained. It is not a entity that you ignore HDL, that is high density,
Sure.
or you take care of only low density cholesterol. You have to manage both.
Fair enough. And some of this is controlled, or there is an element of lack of control simply because of diet. Is that not right?
Diet is one major factor.
Okay. So,
Diet is one major factor, and metabolic derangements influenced by your genetic constitution is other thing.
okay. And on the subject of genetic constitution, now there are some that we've already discussed in terms of modifiable issues, modifiable symptoms. Genetics is not one of them. So, somebody born with that genetics, with that hereditary pattern, what can he or she do? Because certain extra precautions, no doubt, will have to be taken. What are those?
So basically, genetics increases the risk,
Yes.
but the outcome is dependent on your lifestyle.
Okay.
So basically, to improve the outcome, you have to do few things, such as regular exercise. By regular exercise, which we mean is at least you should walk 30 minutes a day
Okay.
for 5 days a week. This is the minimum requirement. Walking more than this is okay.
Okay.
But this doesn't include, that's the main thing. It doesn't include ki people which we meet. They say ki I am walking from my home to the station and then I am going to my workplace. So almost I am walking for an half an hour.
Huh.
So this half an hour walking has to be for your own self, for your health.
Got it.
That means you are waking up, you are going for walking. I am going to walk for my health. So that changes your mindset. Your mind also becomes,
The consciousness of it.
yeah.
I am not going to work and by mistake I'm walking instead of taking an auto or a cab, but I'm consciously waking up and going and doing something for my health.
So that,
Let me ask you this: the pace of walking is also important.
no.
Heart rate has to go up,
No,
because
no.
people get into that discussion sometimes.
No, you just have to walk. Walk
Okay.
at your own pace.
Okay, 30 minutes is a bare minimum, isn't it?
Bare minimum, yeah.
One should ideally be doing more.
You should do more.
Okay.
Because the basic requirement is 150 minutes a week. And it should be divided in 5 days.
Okay.
So that turns out to be 30 minutes a day for 5 days a week.
Okay.
And if you're walking for all 7 days, it's better.
Okay, but
More the better.
Fair enough.
Yeah.
Fair enough. But more than 30 minutes a day is also a good idea, because
Yeah,
a lot of
yeah.
people I know say we're going out for a walk 1 ghante ke liye. And that's a good thing.
Yeah, that's a good thing.
Absolutely. Okay, fair enough. Let me come to what happens when we do actually have a heart attack or a chest pain, as it were, doctor. What is the first thing that one should do when, I'm not even saying diagnose, because these things are even before a diagnosis. You feel a chest pain, you make an assumption that I'm having some sort of a attack or heart problem or whatever. Even before the ambulance comes, what should one do?
See, when we get severe chest pain, especially with what we call radiation, the shoulders, or associated with gastric symptoms, nausea, vomiting, one should not ignore it.
Fair.
That is first thing. Just don't assume it may be acidity.
Yeah.
Better to suspect and act and get a medical help early,
Yes.
because in heart attacks there is a concept of golden hour. Earlier you get treated for heart attack, better are the chances of recovery, better are the chances of reducing the damage to the heart muscle, see, which ultimately is responsible for your pumping of blood. You allow the damage to take place, your pumping of blood by the heart, the what we call ejection fraction will suffer.
Sure.
So it's essential that you understand the seriousness of the issue and avoid ignoring the symptoms.
Okay.
That is first. Second thing is what you can do, say, within your house. It's better you relax. If you have any access to what we call antiplatelet medicines,
Okay.
uh, there are two of them which are commonly used. One is aspirin and other is clopidogrel. So that is one thing which can be consumed, taken.
Antiplatelet is the same as a blood thinner sort of?
Blood thinner,
Okay.
yes.
Okay.
They are blood thinners.
Okay.
So the purpose is, see, when the heart attack has happened, there are very high chances that there was a block existing to the level of 60%, 70%, and suddenly a small clot has formed on top of that.
I see. So,
So,
clot on top of a blockage.
yes.
Okay.
So in that case, to prevent further progression of the clot, these blood thinners help.
Got it. Okay. So this is the
i-
immediate precaution.
Yeah, this is what one can do at home,
Okay.
and then get transport arranged and move to the hospital nearest possible where you reach, and then you have a expert medical treatment available.
At this point, Dr. Mishra, how important is CPR, or at least somebody knowing CPR? Is that crucial, or is that something that will happen at the hospital stage? How does that work?
CPR has to be known by everyone.
Yes.
Because
Okay.
it's a life-saving procedure. It
Okay.
almost improves the chances of survival by 2 to 3 times.
Okay.
So,
But we don't know it. I mean, we've
Yeah.
seen it happen. We've seen a YouTube video. We've seen somebody do it on TV.
So basically, simply to keep it simple, CPR means just compression, compression, compression.
Okay.
So first, once the person collapses, so someone near you has collapsed. So you have to go to that person. You have to just check him whether he is breathing or not. And once you confirm it, that's a simple thing. You can just see the chest expanding or not expanding.
Sure.
And then you have to shout for help.
Okay.
Because there has to be some other person nearby you to call an ambulance.
Sure.
And once you have called for help, you have to start with chest compression. Chest compression means you have to keep your hand on the chest and you have to start compressing.
Okay.
And you have to compress at least 100 to 120 per minute.
That quick.
Yeah.
Okay.
So in general, earlier means it has to be done like 30 compressions with 2 mouth breaths. So even if we are not able to give mouth breaths, we have to just give compressions.
Even that helps.
Yeah, till the time any help arrives, ambulance arrives or any other help arrives. So you just keep on giving the compressions.
Okay. Fair
By
enough.
giving compressions, we are going to maintain his neurological outcome.
Okay, which is important.
Yeah, that's important
Of
because
course. Yeah. Now let me come to some of the myths that one deals with, and I'm not even going to call this a myth, Dr. Bhosale. I mean, there has been enough medical reports that come out when we read about it in the papers, both for and against alcohol. Alcohol in moderation is supposed to be good, especially red wine. Then you will read a report to the effect of all alcohol is bad. The more you consume, the worse it is. What is the latest research say? Can I have a drink or can I not have a drink?
See, when we talk of alcohol, moderation is the key.
Okay.
See, when psychosocially you look at alcoholic consumptions,
Yes.
and the habits associated with alcoholism, it is not just wine or rum or whiskey, whatever brand one goes for. Alcoholics, as you see, they smoke a lot.
Oh.
That smoking is very bad. Second thing is what they eat. A lot of fries, a lot of masala, a lot of salt. So all these things are detrimental.
Sure. It's not just the drinking, it's
Yes.
what's happening around the drinking also. Yeah.
Then coming to alcohol, per se.
Hmm.
See, alcohol per se, when you talk of the quantity, small quantities do benefit by causing dilatation of those blood vessels,
Hmm.
which would benefit to some extent.
Sure.
But anything beyond moderation, excessive alcohol circulating in the blood body systems.
Hmm.
Uh, Before that, there is GI tract, that is stomach and intestine.
Hmm.
Alcohol is irritant. So it's going to induce hyperacidity. It's going to have ulcerative gastritis.
Fair.
So these are bad for health.
Fair. Doctor, let me ask you this. What is the moderation formula? Would very much like you to give me a number, because every one person's moderate is another person's extreme. These things can vary. What should one look
So
at in terms of ml? Do we
see,
have a formula?
uh, say in scientific discussion, these ML concept is not appropriate.
Okay. Okay.
See, ultimately, what one will say 30 ml or 60 ml, the alcohol pleasure of every individual is different.
Fair.
When we talk of psychiatric alcoholism, where there is excess of alcohol intake and then there is dependence, it becomes a substance abuse like situation. So, going beyond moderation, one is at the risk of getting dependent, and then alcohol dependence is a major psychosocial disease.
Is it then fair to say that if you reach the point where you feel you need one regularly,
Yes,
you're
that
getting close to
urge,
dependence?
yes, the urge of getting kicks frequently with consumption of alcohol is a bad sign.
Fair. So, Dr. Abhilash, I want to come back to a point that Dr. Bhosale was making. There's the alcohol consumption. Leave the moderation bit aside, but it's also what happens around that alcohol consumption of unhealthy food, consumption of nicotine, and all of that. Now, even if one is not a smoker and you're in that environment, then we're dealing with second-hand smoke. So those elements are there. Nowadays, over the last few years, one has been hearing about how, okay, then don't smoke a cigarette, do an e-cigarette or do vaping. Is that healthier in some way? Nobody's questioning the cigarette smoking issue. There is no research that has ever shown that it's not bad. But these other elements, is there any truth in that medically?
No, they are also the similar things.
Okay. Yeah. So you can't say one is better, ease off. The only way
all are bad.
Okay.
Nothing is better in that.
So the only way to get rid of it is to go cold turkey and just get nicotine, tar, all of that out of your life.
Out.
Okay, fair. I know that's almost obvious, but it's always good to clarify these things because one keeps hearing that so and so is less bad. Yes. That is not the case. No. Bad is bad. There is no comparison. Yeah. Fair. We have all of this perspective over the course of this episode, but before we wrap up, I do want to ask for one takeaway that I should have, because there's so much information that comes our way. From one takeaway from each one of y'all, that for heart health, for heart maintenance, what should I be doing?
I think restricting to only one takeaway is not going to be proper.
Which is why I'm going to ask both of you separately.
But physical activity has an important role in maintaining heart health.
Okay. And
the second is your lifestyle. Avoid smoking, avoid becoming obese or do weight management. Learn to have your work-life balance as less stressful as possible. I think that will benefit your heart for a longer period of time.
Fair enough. Dr. Mishra, can I ask you to add to this?
So basically, first thing which sir said ki regular exercise.
Yes.
That's the most simple, free, safe way of
Yes.
improving your health.
Absolutely.
And as I already said, ki it should be at least minimum 30 minutes
Yes.
for 5 days a week. The other thing will be diet. And for diet, it's not like ki you have to eat this much amount of chapatis and everything. The diet should be a wholesome diet. It's as simple. Ki it should include green leafy vegetables. It should be with fruits. And basically, there's a proven diet which benefits you in this is a Mediterranean diet. Mediterranean diet is not a Mediterranean diet. It contains ki what all things to be eaten, and it bursts all your myths.
I want to stop you right there because you said Mediterranean diet is not
The Mediterranean
the
diet.
Mediterranean diet, but just then break down what should be the elements of the food that we should
Okay.
be having.
So basically, foods should be inclusive of your fruits. Fruit should be there at least twice a day. And green leafy vegetables should be there because it is high in fibers. Then people will have myths such as the breads, for the breads basically. Nowadays, they generally check for multigrain breads, wheat breads and all these things. Breads are not good. It's as simple. Whatever breads you are going to have, everything is same.
Okay. Even
This-
the sourdough, even the brown. and the
everything.
multi- Okay.
There, nothing has proven to be beneficial.
Understood.
So everyone is on the same chapter.
Okay.
Okay. Then for the non-vegetarians, red meats it's not good. So you should avoid red meat as much as possible. And all other things, basically the salt intake should be as less as possible.
Understood.
In general, we say ki it should be less than 5 grams per day. That cannot be calculated. So it's simple thing. Your whatever amount of salt you put in your food, that's enough. This thing should not include extra salt. You shouldn't be putting extra salt.
Yes.
Then avoid your fried foods. Then avoid papads. It's all of salts, made of salt.
Sir, I'm Sindhi. You're breaking my heart over here. Kya kar rahe ho, sir? But point well
Yeah,
taken. Soda and salt and all
Salt.
of that.
Salt
Yes,
is
yes.
salt. One can compare the increase in salt intake equivalent to smoking.
Oh, it's that bad.
Yeah.
Okay.
The salt is basically you have to restrict salt as much as possible.
Okay.
And the other thing which comes is your dairy products, which we generally see, ghee, butter. That's everyone has the doubts. Our family will say ki you shouldn't be having this, you shouldn't be having that. So in general, milk products are good,
Okay.
but milk products which are made at home.
Okay.
So ghee is good,
Okay.
but it should be made at home, not even your organic one, because since they are storing, it has to be with something.
The
Something is added.
preservatives.
Yeah.
Okay.
Even if they are not saying.
Okay, fair enough. So even
So-
if it says organic, the point is that organic thing still has to be stored on a
Yeah,
shelf for some
yeah.
time till you buy it.
Yeah.
It'll have preservatives. Okay, so homemade is best made.
Homemade is the best thing.
Okay, and so the important thing here I'm taking away is the Mediterranean diet is not what you see on a menu.
Yeah.
It's the raw materials that are there in the Mediterranean diet. You please make it in your own way.
Yeah.
Is that my
No,
takeaway from it?
Mediterranean diet is, they have given the name to the diet. It is in general what all things are to be there in your diet.
The raw material.
Yeah.
Okay, fair enough. And then one cooks it in the style that one makes it
Yeah,
at home.
yeah.
Fair enough. Doctors, thank you so much for this, for your time and for the valuable input that you have given us. We're walking away from this far more educated than we were before. So thank you very much.
Thank you.
Thank you,
Thank you.
thank
very
you.
much.
Your heart works non-stop for you, so why not give it the care it deserves? Today, we uncovered the truths about heart attacks, hidden risks, and life-saving steps everyone should know. A big thank you to Dr. Bhosale and Dr. Abhilash for their invaluable insights. Take charge of your heart health, stay aware, and we'll catch you in the next episode. In the heart of Mumbai stands a name trusted by thousands. Over 1 lakh heart procedures, 200 plus years of combined experience. From diagnosis to recovery, your heart gets complete care under one roof. Because when it comes to your heart, experience isn't optional, it's everything. Zynova Shalby Hospitals. Experience you can trust, care that you deserve.